Hello colleagues, today we will be discussing about a case of a rhythm disturbance, and this is a 34-year-old gentleman who presented to the cardiology department because there was some issue going on the ECG as reported by his clinician. So this was the ECG taken when he presented. Let's discuss this ECG. Now, first of all, having a gross look on the ECG, we can see that there are some obvious findings which doesn't look normal. And by this, I mean that look at the P waves. So for a P wave to be a sinus P wave, which is a healthy P wave, it has to be upright in the leads 1 AVL, inferior leads, and the chest leads, and it should be negative or inverted in the lead AVR. What we can see over here is that the inferior leads 2, 3 and AVF, they are showing inverted P waves and the lead AVR is upright. Now whenever we see such pattern, this suggests that something is happening to the sinus P waves. So the sinus node is not firing, and this has to be some other source that is firing. Along with that, we can see that these P waves are being conducted into the QRS. So every P wave is followed by the QRS. So this is the zoom in view of the P waves which appear to be inverted. So these are very obvious inverted P waves. And these P waves are obviously the non-sinus P waves. The rate of these P waves is 83 beats per minute. Now one should think why with this rate the sinus P wave is not being seen. Well, there are many reasons for that. We'll discuss this further. The diagnosis based on these findings is the ectopic atrial rhythm. So whenever we see this rhythm, we always need to understand few things. Why this rhythm occurs, and is it physiological or there is some pathology behind it. So this can be seen in healthy individuals, and the patient can be perfectly normal and having no issues at all when he presents to the clinician. This should be kept in mind. On the other hand, we should also know that some pathologies like sinus node dysfunction, this can be a manifestation of that. So we need to understand and dig out the history very well before proceeding further. These rhythms are usually transient, but in the case of pathologies, they usually persist. Other causes include drugs, ischemia, toxin, stimulants, and many others as well. So how do you define this ectopic atrial rhythm on the ECG? Well, it has to be a consistent non-sinus P wave morphology. So this area is the area of the sinus node. Because of any of the reasons that has been described before, if this stops firing, then this area they also have a tendency to fire, and these are usually suppressed because of the activity of the sinus node, and that's why it is called the pacemaker of the heart because it drives the rhythms. So whenever it falls down, either transiently or persistently, then someone has to take over the escape, and this occurs at the level of atria. So depending upon the location of the area that fires, there are P wave changes in the form of the shape and the rate which can be seen on the ECG. In our case, this was 83 beats per minute, which is usually a very faster rate as compared to the escape rhythm. So we also need to identify the rate of these ectopic pacemaker. So there is a possibility that this rhythm is firing because this area has higher rate than this sinus node, and that's why it was uh, stopped or temporarily transiently suppressed by the activity of these. And the P waves, they always have to have a consistent morphology, and they usually conduct into the QRS complexes, and the rate to define an ectopic atrial rhythm, it has to be less than 100 beats per minute.